Is that? Wonderful. Let's go ahead and get started. Let's move forward. Hannah Kate, you're first on my grid. So if you want to introduce yourself.
Yeah, hey guys, my name is Hannah Kate Coltis. I work with Montecatini Eating Disorder Treatment Centers in Carlsbad, California. I actually am the alumni coordinator and also work in the business development team with Emily. She's also on. And we treat women 16 and up with primary eating disorder. Thank you so much for having me.
Great to see you, Hannah Kate. Justice.
Hello, everyone. As you may think I'm in a forest right now, I'm actually not. I just would like to be, so I decided to pick the background. Anyways, so I'm Justice Olson. I work with Northbound Treatment Center. They're a dual diagnosis in-network treatment program for adults located in Newport Beach area. Let's see, things about about Northbound. They are really good with their DBT therapy, CBT, and what I really, really like about them is their signature services, including their trauma track, their college-bound and career-bound services. And then also what I really like is the collaboration with the local professionals, therapists. It's the full continuum of care, but anyone could enter in at any level or exit at any level. So we really kind of respect that referent relationship. And, you know, if a therapist is referring someone to us, you know, we really take into account their advice and really approach it in a very collaborative effort. So yeah, I'm looking forward to meeting the rest of you and hearing everything that Barbara has to say, which, by the way, okay, quick story. Barbara is one of my favorite therapists. She gave me a demonstration on CRM a while back, which is one of the modalities she uses. And it was probably the most intense, therapeutic, positive session I've had in my entire life in just the one demonstration. So you're amazing, Barbara.
Thank you, Justice. And no pressure, Barbara. Wow. Good job. Cool. Thank you, Justice. Lorna.
Hi, I'm Lorna Meinweiser. I'm in the Sacramento area, and I'm a coach and a trainer. I train in emotional freedom techniques, the tapping, and I am a coach using that. And I'm especially drawn to when I saw the ad for Mind Body, because that's where I work. And of course, I know Barbara, and I did my master's degree on attachment theory. So I'm looking at, you know, I use it in my work and thinking how I'm always ready to learn more.
Thank you, Lorna, and welcome.
Thank you.
Melissa, good to see you. I'm going to unmute you. There you go.
I always do that.
It's all right. We all do. It's okay.
Anyway, hello, everybody. I'm a therapist in San Jose, in the San Francisco Bay Area. You guys are mostly Southern California, yeah? Anyway, I work with trauma and addictions a lot, also eating disorders, which I file in the trauma and addictions bucket. Also bipolar and troubled teens and desperate parents. And I have the occasional couple. I like variety. And I am an EMDR certified practitioner. And so I do EMDR when it is appropriate for the clients that I'm seeing. And it's great to see you all.
Thank you, Melissa. Welcome. Emily.
Pellegrini, and I work for Montecatini as the Director of Business Development. And as Hannah mentioned, we treat primary eating disorders for women ages 16 and up. And we have all levels of care, so residential, PHP, and IOP with transitional living. And our PHP and IOP is all in person, so we're not doing any virtual right now, but it might be switching back to that. So stay tuned. Thanks for having us, Mike.
Thanks, Emily. Absolutely. Yeah, we all stay tuned for the changes every day. So thank you. Krista.
Hi.
There you go.
I'm Krista McKinnon. I work for Newport Academy as the clinical outreach specialist. Newport Academy has homes for adolescents, and we're most well known for our adolescent homes, residential treatment facilities, but we recently opened Newport Institute, which is for young adults as well. And we serve primary mental health. So in the Bay Area, there's really a lack of primary mental health residential treatment. So we're excited to have opened our young adult residential treatment homes.
And do phenomenal work. So welcome, Christy. We love
Thank you.
what you
Yeah.
guys do. So absolutely. Lori, you're muted. Hold on one second. Can you unmute yourself? There you go.
I'm muted.
There you go.
I'm Lori. I'm a primary therapist at Eating Recovery Center in Sacramento. I am right now virtual and running intensive outpatient programming, but we do still have on-site PHP and treat eating disorders and co-occurring disorders that go along with them.
Thank you, Lori. Welcome. Kelly, welcome.
Hi, I'm Kelly Grock. I'm in Great Eagle, California and Reno, Nevada. Marriage and family therapist. I do all ages, I guess my specialty is substance use disorder, but I do a little bit of everything. So.
Welcome, Kelly. Glad you're with us.
Thank you.
I know Andrew's joining us. Andrew, are you there yet? Have you connected?
Give me 1 second.
Just wanted to get to you first before I got to the Akua team. There
Hey.
you are. Go ahead, Andrew, introduce yourself.
Oh, hey, I'm Andrew. Hi, I'm Andrew from American Addiction Centers. I handle Northern California for us. We specialize in dual diagnosis inpatient treatment. We have 9 facilities all over the country, about 1,100 beds total. I want to tell you a little bit about Laguna Treatment Hospital, though. That's down in Southern California, right by our friends at Akua, of course. And we're doing great work down there with high levels of acuity and working well within the Blue Shield policies throughout the state. So I would love to be a resource for all of you for all that and help support our clients, our mutual patients through that journey, because I know that can be a tough part too. So I just want to thank you guys so much for having me. And of course, Angelina, thank you so much for giving me a couple minutes and the time and the invite. So I'll be right here. If you have any questions, thank you so much, everyone.
Thank you, Andrew, and welcome. I know I have 2 reps from Southern, Taylor and Dan's on. They're not on their screen. I don't mean to purposely skip, but for time purposes, I'm going to move forward to Angelina and let her just do a brief introduction. And then also I want to let her to introduce Barbara, our guest.
Oh, there's
Go ahead,
Dan.
Angelina.
Hi, welcome everybody. First, I want to start off with saying thank you so much for taking time out of your day to come and support Akua and also support Barbara. I'm familiar with a lot of you guys. Kelly, hello, it's so nice to have you. Some other of my Sacramento peeps, Justice, Lorna, and Lori, thanks for coming. Yeah, so Akua has facilities kind of all over California. We have facilities in San Diego, Orange County, as well as Sacramento. Our Sacramento location has 2 facilities. Both are considered dual diagnosis, but one is for primary substance use, secondary mental health, and then the other facility we just opened a couple months ago is actually primary mental health with either no substance use or secondary substance use. That's something really important to know, because I know a lot of people, some places will say they can take mental health, but there has to be substance use. So our facility up here, that's primary mental health, they can have substance use or there doesn't have to be any substance use. A little bit about our substance use facility, we actually have a first responder track. And the reason why I say that is because yes, there's a need for, first responder specific treatment, but because we are able to first responders, a lot of my staff there are equipped to treat trauma. You can't treat a first responder if you're not equipped to treat trauma. So both facilities, we have brain spotters at each. So all of my therapists have been trained in brain spotting, which is amazing to have. Those of my therapists out there know how powerful brain spotting can be. And then, like I said, our mental health facility, we are one of the only treatment centers that does inpatient residential treatment up here in Northern California for primary mental health. So that's something to note. I want to go ahead and introduce Barbara. I have been working with Barbara for, oh my gosh, definitely over a year, maybe coming up on 2 years. you know, Akua has been doing weekly lunches, and we've decided that we actually, you know, what better way to collaborate with the community than getting them on these Zoom calls and having you guys get to meet, you know, people that we love working with. Barbara is a private clinician. She has taught me everything that I know about attachment, which is why I have her speaking on attachment. I think one of the greatest things I've learned from her is, you know, when we talk about the substance use population, we say, you know, don't treat substance use if, you know, you can't treat trauma, because a lot of times the underlying issue of substance use is trauma. But what I've learned from Barbara is that a lot of the times the underlying issue of someone developing PTSD, which she'll get into, is attachment issues. And so many individuals in this world are struggling with attachment issues, and sometimes we don't even know it. You know, we have kids coming from, you know, one parent homes or no parents, and parents maybe were physically present but we're emotionally present, and there's a lot of attachment issues going on, and sometimes we're not even aware of them. So I am super excited to have her here today. She is too humble and won't probably go on and on about herself, but what Barbara is known for up here in the Sacramento area is she does amazing work with first responders, very gifted and talented in treating substance use. I'm going to list them all: substance use, trauma, attachment, and grief. So I am going to go ahead and pass the mic over to her and let her take it away.
Thank you, Angelina. I appreciate your confidence. So I have a PowerPoint presentation. Am I able to share that? You're muted.
Hold on one second.
You should be able to.
Got it.
You got it now.
Okay. So what we have learned over time is we've been in Afghanistan long enough to begin to notice who gets PTSD and who doesn't in those worst case scenarios. We know that you can send two people into the very same horrible experience. One gets PTSD, one doesn't. Why is that? Turns out at the base of all that is attachment. This marries beautifully with the work of all of the ACEs work that we're hearing about. And what we're learning is that if you have that happy, healthy, well-adjusted family that we almost never meet, but we hear about on TV, what's happening is that you're creating a very stable, secure nervous system. And those people with those secure nervous systems kind of spring when stuff lands on them, and they remain in touch with who they are, the meaning of life, the meaning of the future. They're able to access resources and get the help they need. They have no problems experiencing and expressing their feelings and processing the trauma, so that they pop out in the end in much better shape. People who tend to get PTSD are those who have those not so secure families, and so their nervous system is more a little bit like rice paper, and they can easily fall through and collapse. So when bad things happen to them, either in childhood or all along the way, they react to them much more strongly. They have a much worse impact. They don't reach out for resources. It shifts their paradigm of life and people in the world, and they will then collapse into PTSD. We've also learned over the years about what they now call complex PTSD. So if you have had that developmental trauma of not having that family that built that secure nervous system, and then you start adding some childhood trauma and then some adult trauma, it's so complicated. By the time you get to our offices, there's a great deal of work to do. So basically, what is attachment? If anybody made it through any kind of a training program in addiction or therapy and didn't have to take a class where you learned all about attachment, you should go and sue the school. But basically, when we think of attachment, we think of relationship. We think, I trust people. We think of it more in our heads, but it's all about our nervous systems. Attachment has everything to do with neurology. And so we learn all that from our primary caregivers, primarily mom. And it is a very subtle and daily process that occurs well or doesn't occur well according to what mom brings to the table. So basically, every part of your nervous system, which then impacts every part of your life, is affected by those initial early caregiver relationships. So when an infant experiences consistent care, they believe they're safe, they're valuable, they're heard, and that's the foundation that helps them to build healthy relationships. How all of that works is so very tricky, and because I love brain science and would rather read a book about the brain than watch TV, I'm completely too full of data in that area. So it happens in our interactions with mom. So ideally, we are born to that happy, healthy, well-adjusted mom. When we're born, the right prefrontal orbital cortex of our brain is not formed much at all. If all of the neurology that we need to be grown-ups was in place when we're born, our heads would be so big we couldn't get out. So a lot of it has to happen afterwards as our heads grow and there's room for it to be. But it forms in the last trimester of pregnancy and up to around 2 years. And it is all relational. It is all interactive. Every single part of it is relational. Alan Shore, one of my primary references, is very much a neurologist who's into the study of pre-verbal memory and actually what's going on in the uterus for the baby and how it impacts them before they even get out of there. But when you come out of the womb, babies don't have a lot of frame of reference for anything. Everything they know about safety and belonging and relationship comes from mom over the course of those 2 years. So when the baby comes out, all of their needs were met automatically. So now this baby wakes up, they have a wet diaper, and they're hungry, and they're gonna die. If you've ever raised an infant, you know, they have 2 speeds screeching off. And so they're hysterical, they're alone. How did this happen to me? Where is my nice warm water? And so they're kind of freaking out. In that perfect world, mom comes into the room and she's so excited to see her new baby. So her body exudes all this joyful energy. When the baby looks up into mom's eyes, the baby sees that someone is glad to be with them. They see a face that thinks they're amazing. Not only does this help the baby not feel alone and confused, but it also begins to define what the baby believes about themselves. I am what I see on the faces of my caregivers. And if I see joy and excitement on the faces of my caregivers, I must be pretty cool. If I have a depressed mom and she just kind of shuffles into the room doing the best she can with what she has, I must not be so awesome. If I have an angry mom, then something must be wrong with me that I cause my caregivers not to love me or to be angry at me. And babies are all feelings. We know that within 6 months, a baby can actually mimic mom's faces and as much as possible attune to mom's emotions. Because babies figure out that pleasing mom is how I get my needs met. And they learn that so early, it's unbelievable. In one experiment, they took 12 babies and they had the moms put headphones on their bellies and they read to the babies every day. And then those babies, when they came out, they were given a special pacifier. And within a very, very short time, those babies learned that they could suck that pacifier in a specific way that caused them to tune through those 12 moms. And in no time at all of those babies were sucking the pacifier at a rate that got them their mom reading to them again. So they could tune this little machine so they could get that mom reading sound going again. And that's brand new infants. So think what they could do by 6 months. If you don't know how much our children know how to work us, you haven't raised any teenagers. So all of these attachment experiences are coded in implicit, non-verbal, pre-verbal memories that are just coded in there. And a lot of the stuff that people work with in trauma is pre-verbal stuff. So if we don't know how to help them understand that there's a body part of their trauma that's not necessarily in the head part of their trauma, it can be very confusing. An example of how hard it is to get people to change when they have these sort of pre-verbal encoded memories. Suppose that I asked you to go with me to the busiest street near your office and stand on the sidewalk, put in earplugs, and put on a blindfold, and I said, just cross the street, you'll be fine, they'll stop. Nobody likes to run over pedestrians, just cross the street. Can you feel your body right now going, oh, are you kidding? I'm not doing that. So we are so conditioned from earliest memories, you do not cross the street without looking both ways. So we just don't let that happen to us. Well, when we have clients who have not had the kind of attachment experiences that their body needed to thrive and grow, and we start saying, just make some phone calls, just go to meetings, just hang out with people, get in a supportive group, they say, okay, and then that never happens. And we can be so mystified by that, because if we have supportive relationships and we have groups of peers that we go to for support and encouragement, we know how nourishing that can be, and we don't understand why everybody just doesn't want to rush out and do that. But a nervous system that was trained that people aren't safe and I'm not especially valuable isn't going to do that. So the primary thing is that attunement to the caregiver, and how that happens with mom. Mom comes in the room, has that joyful experience of the baby. Her face lights up. She's so excited. The kid woke up and she gets to play with it. I've waited for you for 3 hours. This is during the day, not at night when she'd rather be asleep. And so the baby knows that mom's excited to be with them, but simultaneously, the right hemisphere of mom's brain attunes to the baby's right hemisphere, just automatically. And mom starts to downregulate her heart rate so that she downregulates the baby. And they both go down and calm, and all those endorphins and those natural dopamine experiences start firing. So the baby's whole nervous system experiences mom. Her right hemisphere says, I'm here, you're not alone. But mom is also installing the app for all the baby's emotions. She's installing joy so the baby knows how to be joyful, but she also knows how to back off when the baby needs a break. So she's teaching the baby to experience joy and rest, and joy and rest. But she's also coming and saying, it's okay, baby, you're just hungry, you're just wet, I got this. And so in her knowledge of what's happening to the baby, she's teaching the baby what's happening to it. And in the process of helping the baby downregulate, she's teaching the baby how to downregulate. And then afterwards, after they've had this lovely connection where the baby feels loved and connected and their pain is reduced and their pleasure is increased, they develop the desire to get more of that. And so they learn to do those attachment behaviors that get them more of that good stuff. And they're highly motivated to get mom back in there and to have more of that love and joy. And that carries over into a lifetime. Babies cannot self-soothe for a year. You know, my kids were raised in the Dr. Spock era, just let them cry it out. I feel so bad about that, because what we've learned now is they didn't learn to self-soothe at 6 months, they learned to give up. But if a baby has a million of these successful interactions with mom, right hemisphere to right hemisphere, calming, joy, if mom can come when I'm angry and connect with me and say, it's just anger, look, this is what you do when you're angry, and mom stays with me and loves me. If mom can be with me in those big 6 emotions, so anger, fear, disgust and despair, and sadness and shame, she's helping me install the app for those feelings. And so when I feel angry, then at about a year, I start to be able to dip into the bucket of memories of mom and drink from those memories of mom to do some self-soothing. Nobody can self-soothe indefinitely, but a baby can begin to remember how to soothe themselves and get better and better at that. But they really need as much of mom as they can get for 3 years, if that's available to them. And if mom has to work, then mom needs to come home, park her phone until the baby goes to bed, and give the baby all she's got. Because that right hemisphere won't connect to the baby if she's reading her text messages or her email. And so as much as possible, babies need all that mom has for as much as they can get for as much of 3 years. And that's kind of a controversial issue, but neurology is bearing that out. So attunement to mom really means synchronizing the baby's brain. And so when mom can synchronize her brain to the baby's brain, then mom can teach the baby to synchronize their own brain. And so our brain functions at 4 levels. And these are the levels at which we learn emotional regulation, how to attune and synchronize to other people, and who we are. So as mom comes and enjoys me, as dad comes and enjoys me, I decide I'm enjoyable. If mom and dad are broken and they don't do that and they don't install that, then I don't have it either. And if mom and dad can attune, I learn to attune. You can go into a kindergarten classroom and you can see which kids know how to attune. Those kids who already in kindergarten just know the ebb and flow of the social environment. They're the ones who get invited to the sleepovers. They're the ones who are somebody's best friend. And the ones who don't know how to attune, they run along next to. They try really hard, but you can already see them struggling if you know what to look for. A kid may be a gifted athlete or especially attractive or especially brilliant. They may have something that earns them into their peer group, but if you observe them carefully, you can see they still don't get it. They're still not those kids who just know how to go with the flow of relationship. And so we also need mom and dad to teach us how to help our left and right brain stay synchronized. We know in trauma that the way trauma stores is that the part of your brain that can integrate sensations and emotions into the actual historical event is offline. And so it kind of stores all scattered and you've got to get it all back together. And we know that during a trauma, the part of your brain that manages the timeline is offline. So it doesn't move along into adulthood. It stays in that moment in time. It's just that upsetting. And when they're having those emotional flashbacks or actual flashbacks, it's a here and now thing because the brain hasn't been able to get all the parts to synchronize. And so the control center of your brain is basically in the right hemisphere. And the right hemisphere is the part of your body that knows what happened. It's the part of your body, part of your brain that holds the emotional experience. Your right hemisphere cycles 6 times per second, while your left hemisphere only cycles 5 times per second. So what that means is that if I hear someone come in the room behind me, the minute that I see them, the minute my right hemisphere experiences them, it will tell me the right hemisphere story of that person. And if I like them, I will immediately show on the left side of my brain what I think about them. Sadly, that is before the left side of my brain even realizes they're there. So before my logical brain realizes that you're standing there, my right hemisphere has already told you if I like you or not. So by the time I see you there and think, act nice, it's too late. I'm already not acting nice. And so my right hemisphere is what gets me in all the trouble. The right hemisphere runs the brain. So if you've ever had traumatic reactions to anything, you know that once your heart rate gets up to a certain point and the right hemisphere takes over, it's running the program. And your left hemisphere is nowhere. That person who has all those plans, has that relapse prevention plan, has all those goals, knows all those rules, they're nowhere. And so when your heart rate comes back down and the left hemisphere kicks back in, then it's judgy and mean. it was your fault, you knew better than that, we weren't going to do that. So that isn't helpful at all. First, the little kid takes over, runs a program we don't want to run and don't understand what it is. And then the left hemisphere comes in and says, what an idiot, why did you do that? Unfortunately, the left hemisphere does that when we're children as well. So we know a lot of molest survivors convince themselves it was their fault. I shouldn't have been there, it's because and so that makes it harder to work with trauma survivors because they're 10 times meaner to themselves than anybody else could be. So it develops during the first 24 months of life. And if it develops well, it's because of all that brain synchronization. So the baby's right hemisphere, which doesn't have any training or knowledge or understanding, just launches. And then mom comes in, all that good stuff happens. And so that right hemisphere is being trained. Oh, I can get my needs met. People love me. I'm important. Okay, this is going to work. But again, if we don't have that mom that can attune, the baby is left to figure it out themselves. And we know that's not going to go well. So if you look at our clients, people who have these happy, healthy, well-adjusted moms rarely show up in our offices because they're just doing it all day long. Who shows up in our offices is people who struggle to experience and express their emotions. And in the absence of all that joy, download the app, calm yourself down joy stuff, they just get activated and don't know how to get deactivated. And so there's a wonderful book by Alan Shore called The Science of the Art of Psychotherapy, which is the hardest book I've ever read, but great book nonetheless. It's in my references. And he talks about what makes us great therapists is our ability for our right hemisphere to attune to the right hemisphere of our clients. And in doing so, we downregulate our heartbeats, we lower our activation level, and we hold them in a therapeutic alliance, which makes it safer for them to process in our offices, regardless of whether we're doing EMDR, talk therapy, CBT, no matter what mode we're doing. If we can attune to our clients because we can attune to ourselves, it's going to go better for all of us. So basically, the control center of the brain has kind of 4 levels, and this is a broad overview. But level 1 is my attachment trauma, and it's there, the little green area, and I'm attached, and so I'm safe. So when mom comes in the room, the baby says, oh, okay, I'm okay, I'm okay. Little kids with great secure parents, when they have problems, they go to their parents, they get their needs met, and they go back out and play again. They don't stay on the lap forever. Level 2 brain is what I engage in or avoid. So it's who I connect with. It's where I belong, where I fit. And level 3 has to do with how much energy I'm directing to a project. Like when I'm overwhelmed, can I calm myself down? And level 4 is kind of that where I'm able to use my left brain as much as my right brain, so I can adjust to reality in this moment. Oh wait, I am upset, but you're being affected too. Who do I want to be when this is over? So an example is, so the example I use is if you are a food addict and your favorite addiction is Dunkin' Donuts, and during this meeting, you get a text message telling you that Dunkin' Donuts will be giving away donuts at exactly 2 o'clock. So if you're not a food addict, you might glance down at your watch and think, oh, I could do that if I wanted to. And then you would just return to the meeting and be fine with it. If you're a Dunkin' Donuts addict, you're going to look down and you're going to try to figure out precisely how long it would take you to get to Dunkin' Donuts after this meeting is over. And maybe if you're on your phone, you could drive to Dunkin' Donuts during the meeting. And so that is your attachment figure. Dunkin' Donuts bring you joy every time you ask them to. They always soothe you and comfort you. They're always there when you go, almost 24/7. And you know what you can get from them, and you know what they're going to give to you, and you have become addicted to them in the way that ideally you should have been securely attached to your caregivers and now loving and safe people in your life. So I'm going to seriously engage in worrying about those Dunkin' Donuts, because that's my connection to safety and reality. And I'm going to worry, if this speaker is going on and on and on, that you're going to keep me from getting to Dunkin' Donuts in time. And I'm going to figure out how to get off this meeting early if I have to. And I'm not going to be able to get my left hemisphere to kick in and say, wait a minute, don't you remember? You promised yourself you wouldn't go to Dunkin' Donuts anymore. Remember, you don't want to do that anymore. Remember, you made yourself a promise that you would, you know, never do off-track eating without calling your sponsor, and you're not going to have time to call your sponsor on the way to Dunkin' Donuts. So I'm not able to bring my left and right brain into synchronization. So this is kind of a broad overview of those levels of pain. So when I'm experiencing attachment pain, we know if you work with addicts, they are in love with their substance or behavior. I've many times had addicts tell me, I take drugs because I like them. I can stop anytime I want. Well, okay, give that a try. See how long that lasts. Because if you have not had your attachment needs met, and you're that miserable little kid who never feels safe and never feels like they belong and never gets their needs met, you're kind of buzzing all the time, going along in some form of misery all the time. And when someone introduces you to a substance or behavior that makes that buzz quiet, your nervous system literally rewrites the code in your brain that says, there it is. That is the thing I've been waiting for my whole life. I will never be without again. And it becomes a life-sustaining behavior to your nervous system. So it's not that you're an idiot who can't just stop doing that thing. It's that your nervous system found its savior, found the connection that it longed for, and is never going to be without that again. So in treatment, we find that inpatient programs that are able to create an atmosphere of secure attachment, where people are seen and observed and cared for and sought out when they're struggling and they get their needs met. You know, when you're an inpatient, you go sit in the main room and people come and check on you. You can't be miserable in inpatient without people coming. So you get your attachment needs met, that craving, that thing in your brain that's saying, I'm gonna die because I don't have my attachment figure and there's no substitute, but then get substitutes. That's one of the most important things we do for people in treatment, is we put them in an environment where they begin to learn to attune their brains to the people around them. They begin to get joy. They come out of their room and to the main room and people look up, hi, Angelina, it's great to see you. Their eyes light up, their pupils dilate, you get the smile in both the eyes and the face, the body language opens. They get all of that attachment reinforcement that they longed for their whole life and never got. But it's a freebie. It's not them saying, oh, look, I'm finally getting my attachment needs met. Oh, let me see how I can rewrite my nervous system so that I make sure I get this when I leave here. That doesn't happen. So if they attach their recovery success to all the stuff we cram in their left hemisphere, all those goals, all that left hemisphere stuff, and they don't understand the importance of the right hemisphere stuff that's happening, guess what happens the minute they get activated? The right hemisphere takes over, nothing we taught them makes any sense or does any good, and off they go. And we're thinking, but you did so good. And so they can have these incredible experiences. We know the longer someone stays in structure, the better they do. Brain science tells us it's because the longer they stay in structure, the more they learn to get their emotional needs met in a safe environment, and the more they can begin to do it for themselves, just like that one-year-old baby. But that's if we treat their trauma along the way as well. So the next level of pain has to do with belonging, connection, or affiliation. So I don't belong anywhere, no one really cares about me. It's different than attachment pain. Attachment pain is the longing for the one, the one that gives my life meaning. This is more like, where do I belong? Where do I fit in? And if I know that I'm part of a group that can help me get through something. Research teaches us people going through stuff together do better. There's a research study where they had just a research assistant. A couple comes in, they say they're going to do this experiment. The wife's going to experience some minor discomfort. If the husband is touching her while they're describing it, she's way less activated. If the husband is with her while it's happening, she's way less activated. But interestingly, if the husband's left in another room and a research assistant just holds her hand, so there's someone with her as she's experiencing this mildly discomforting thing in the experiment, she's way less activated. So just feeling like someone's with me, who I am, where I belong, what do I and my people do. So when I feel like no one's listening to me, I need someone to say, I'm with you in this, I'm with you, I hear you, and help me calm myself down. The next level is the pain of overwhelm. So because we're not able to experience, express, and manage our emotions well, unless we learn that from mom and dad, the way that fires is completely out of control. So if mom has taught me it's okay to be mad, I can see that you're really mad at me, I love you anyway. If mom can be with me in anger, then I can be with me in anger, and anger can be with me. So it happens in a part of my nervous system that's part of my database, part of my skill set. But if mom doesn't install the app for the big 6 emotions, then when I'm angry, it's like happening over there. I'm watching somebody be really mad, but it's not me, and I don't know what to do about it. So you see those people that rage out of control, you can say, you know what you said to me? And they're like, oh, I would never say that. Or you show them a video and they look at it like maybe you just created that yourself out of nowhere, because that's not me. That's how our clients can go into sadness and end up so sad for so long that it becomes horrible depression, because no one ever taught them to manage sadness. No one ever taught them how to manage shame. So when we are with people who have what they call mindsight, people who can feel with me, people who get where I am and can be with me without correcting me. So that a sponsor relationship is a great example of that. A good 12-step meeting where I can express a great deal of anger, and I look and people are looking into my eyes and nodding their heads, and their body is saying, I know, I so get it. And that helps me to incorporate my emotions into my nervous system in a way that I can use them as tools. So someone who can mirror with me helps me join me in my rage, say, and then helps downregulate my heart, slow down my nervous system, and help me be able to self-soothe. Oh, that's right, I remember what to do. So then the next level is, it's just when I'm feeling inadequate, like I don't have what it takes to do this. Unparented adults often find themselves in situations they have no idea what to do. So when my husband died 4 years ago, he was like MacGyver. Suddenly I'm a homeowner and I don't even know how to do half of the stuff he knew how to do. Thank God for YouTube. But initially I'd have these huge reactions like, oh no, I can't do this. It's just too terrible. It's too blah. But gradually over time, now when something happens, first I think, oh, what would Butch do? And the answers come in my head like, oh, that's right, you were paying attention. And if no answer comes, there's YouTube. So I watch YouTube and think, I can do this, look at that. So now I'm teaching all my old lady friends how to learn stuff on YouTube and do plumbing. So it's cool when you know how to get what you need, or when you feel like you can fulfill the role that's being asked of you. But when I feel like I'm too little, too young, too not enough. So when you know how to step into the roles that are being demanded of you, you know what to do. Back to that great parent. A great parent is wonderful at helping children learn to do new things. They say, it's okay, honey, we can learn this together. We can learn this screwdriver together. We can, blow up stuff together. We can work on the car together, and laughing when there's mistakes. Those parents teach their kids well, I can figure this out. I know how to do it. I can be this person that I need to be. So that's another part of that attunement that we learn from our parents and sponsors in 12-step meetings who can say, I know it's really hard, but guess what? You're not the only person who's ever experienced this. People in 12-step meetings helping us to realize it's a learning curve. Come on, we're all learning together. Let's do this together. So they help me step into my role as a recovering person, as a growing adult, as a becoming adult. And that helps me to feel competent and capable. And then level 5 pain is just basically, I don't have enough information. So I can be really upset about not having enough information about something, but I'm not having attachment pain. It doesn't necessarily cause me to have cravings. But cravings are always rooted in attachment pain. At this level, if you just, tell me where I left my car keys, then I'm not upset anymore. So this is just a level where I can mostly learn from explanations, education, knowledge, more information. So what we know about our clients is that the worst thing for them is many of them have the various types of maladaptive attachment styles. And so when they didn't get their needs met by people in childhood, they sure don't think they're going to get a need by grown-ups in adulthood. And that's one of the hardest parts. There's jokes in 12-step meetings about the 500-pound phone. No, I can't call someone. I have to clean the bathroom. So just anything we'd rather do than call and be weak and needy. So unfortunately, if we can't get our attachment needs met, we will find external sources of self-medication. And we know there's many, many, many. People are not just addicted to one thing. They're addicted to lots of things. Most of us with addictive personalities have a backup plan. If we can't get one, we just switch to the next. One of the things they say is at the Salvation Army, when we were treating men, addicts and alcoholics, if we didn't also delve into their relationship with sexual addiction, we were just leaving a lot of important stuff on the table. But that was very awkward for them to try to work on that with their grandmother here. And so you can then look at all the maladaptive behaviors that you see people doing as attempts to regulate their emotions that fail because they don't meet the needs and they don't solve the problem. But when they try something new and it fails, they say, see, I told you. So we have to help our clients realize relationships don't fail because everybody that you've tried to date is crazy, or that dating is crazy and relationships never work and you're a horrible person. We have to help them understand if you picked people that were less complicated, that might go better, and help them understand why they're so attracted to such complicated people. So the good news is that neuroplasticity teaches us that much of this damage can be repaired. And it also teaches us that most of that repair will occur in a relationship. And if we can't form those healthy relationships with our clients and to help them form healthy relationships with other people, that's the lab. So the most horrible thing for me about this quarantine is I do comprehensive resource model, which is all about repairing attachment wounds. So I do sessions with people that teach them they're worthy and valuable and they deserve to be loved and chosen and find healthy relationships, but they can't. And so it's terrible. I just think the most horrible thing that can happen to someone with an addictive personality is isolation. And now we have a whole country that's forcing people into isolation. So our programs just need to help understand how attachment is the foundation for well-being and how to repair what can be repaired through healthy relationships with us and others. So, any questions?
Thank you, Barbara. I know that's a lot of information in that time period, and it's fascinating. I love the brain. I love how you're speaking, and so I know we have a few minutes left. So, I mean, does anybody have any specific questions for Barbara? Do you mind stop screen? Can you stop the screen share and so we can see everybody?
Sorry.
No, it's okay. Thank you so much. Thank you. Does anybody have any specific questions for Barbara, or comments or feedback?
Will
Okay.
will the slide set be available? There was a
Yeah.
ton of useful information there.
I will send it to Angelina.
Okay, great. Thank you very much.
Yeah, Angelina, just send it to me, and then I'll have marketing send it out to everybody on the call.
Sounds good.
Any questions? No, I think it's phenomenal. Thank you, Barbara. I think, I know this is probably more of a 3 or 4 hour, kind of presentation crammed into 45 minutes or 40 minutes. And so I know that's a lot, but, I'm sure as the knowledge is there, we'll probably ask you to have you back, and, maybe we can continue the discussion or go into some other the topics that you have as well. Because I know that so much is so connected and so much relates. And I think it's fascinating. So if nobody has any questions, we can jump off a few minutes early. I can let everybody go. It's been great seeing everybody. Happy July. I hope everybody had a safe 4th and celebrated in good ways. And definitely we look forward to seeing everybody next Wednesday as well. So we'll get that topic out as well. Thank you, Barbara, for your time today. We really appreciate it.
Thank you for having me. It was good to see you guys.
Absolutely.
Thank you so much. Thank you.
Everyone have a great day.
Bye, everybody.
Bye.
Thanks, everyone. Have a great day. Thanks, Mike.
Thank you, Andrew.